Simulation in education is the next new thing. Welcome to Intern Bootcamp, an annual event held every year at the University of Cincinnati's Oral and Maxillofacial Surgery program in Cincinnati, Ohio. Contrary to popular belief, simulation can be rather low fidelity but equally effective and does not need expensive technology or equipment. The event starts with a pretest to establish a baseline level of understanding prior to the simulations. First, the participants are educated on the basic surgical armamentarium. These are the instruments that they will learn to use for the rest of their careers. Using these instruments, the participants can then learn how to suture. Pig's feet replicate the feel of human tissue to practice on. Similarly, the participants can learn how to plate a fracture or how to perform maxillomandibular fixation. Practice scenarios with effective teaching points can be simulated with these plastic or foam skulls. A simple tube with a rubber skin over it is all that is needed for a resident to learn the principles of starting an IV. Fortunately, simulation can quickly progress to a real test if a willing test subject is present. Similar to the IV simulation, a rubber skin can provide a very real simulation for the placement of a Foley catheter. Management of the airway is also critical. Using a mannequin, it is possible to simulate various airway emergencies to build competence in the event of a real scenario. Various airway adjuncts are introduced to the novices and their proper placement is taught and practiced. Using something as simple as a watermelon, one can learn and practice a head wrap as well as proper sterile technique. This is done inside the operating room to suspend reality. This is the core of simulation, training in situ. At the conclusion, the participants will then take a post-test so that we can measure the efficacy of the simulation exercise. Additionally, the group engages in team-building exercises as a method of reinforcing the information they learned during the day. Essentially, the simulations performed here were simple, but were thought out, implemented well, economical, and found to be very effective. These scenarios are reproducible in any training program in any part of the world. One simply needs to get a little creative to suspend reality. Thank you for your interest in the University of Cincinnati's Oral and Maxillofacial Surgery Intern Bootcamp program.